Okay, this is Chloe and Kari, and we're going to be talking about DMOAD or glucosamine sulfate. So what is DMOAD? It's a disease-modifying osteoarthritic drugs. There's two types. One type is a drug that attempts to directly improve the viscosity and function of synovial fluid or viscosupplementation, or agents that serve as precursors to the normal constituents of joint tissues, or glucosamine and chondroitin sulfate. And that's the type we're going to be talking about. Our Saccone pharmacology textbook does a great job laying out the two different types of these, but we'll just be talking about that second type. So what is it? Glucosamine sulfate, aka glucosamine, is a chemical found in the human body around joints, and it's involved in the formation of cartilage molecules. Sulfate is added to the naturally occurrent chemical. It's a common dietary supplement. It's available over the counter without a prescription, and a physician and pharmacist consultation is suggested. The class, it's an anti-inflammatory, so to reduce inflammation, and it's an anti-rheumatic, or to slow down the disease progression. Glucosamine is a drug that covers two very important and common drug classes. So we're going to talk a little bit about the indications now. So osteoarthritis, general OA, specific joints indicated by the knee or TMJ arthritis. Other conditions could be Cashin-Beck disease, which is a bone disease, or circulation problems, diabetes, inflammatory bowel diseases such as Crohn's, and then MS and RA. Contraindications and precautions when taking this drug. A precaution is hypertension, lipidemia, diabetes mellitus, hypersensitivity, allergy to seafood or shellfish should be contraindicated. Also with children under 18 years old and under, there's a lack of data to support that. Do not take if you are a woman who is pregnant or breastfeeding, if you have asthma, or surgery scheduled within the next 2 weeks. Patients with diabetes need to take extra caution while on glucosamine sulfate. These patients will also need to require more monitoring because of the glucose in there. There's a significant lack of data in how glucosamine sulfate works in children under the age of 18, but glucosamine sulfate may worsen the asthmatic problems in those who have asthma. Administration and dosage comes in an oral pill, 1,500 milligrams per day or 1.5 grams per day of glucosamine. For general osteoarthritis, 1,000 to 2,000 milligrams daily for up to 18 months. For knee osteoarthritis, commonly 300 to 500 milligrams 3 times daily for up to 12 weeks. TMJ arthritis differs a little bit with 500 milligrams 3 times daily. Single dose or divided into multiple doses throughout the day, and it may take up to 4 weeks for people to see a full benefit. So it's basically always just administered orally. Now getting into the pharmacokinetics, it's absorbed. Oral administration is the most common, as we said. Have reported that the bioavailability of glucosamine after once daily oral dose persists in the circulatory system of the patient.
Okay, mechanism of action. The idea behind glucosamine is that it helps protect articular cartilage and reverse or halt joint degeneration caused by OA. So, glucosamine is an ingredient that produces articular cartilage and synovial fluid. Increased amounts of it should help repair the joint tissues, improving synovial fluid viscosity, and help bring back joint functions. This is where people get the idea that if they take glucosamine supplements, they're helping their bone and joint health. The notion that more of a possible good thing leads to better results. It's also suggested that it may stabilize the turnover of cartilage and suppress cytokines production, and cytokines contribute to pain and are involved in the destructive changes in OA. So for monitoring, Patients need to be monitored for up to 8 weeks because it could take up to 8 weeks for symptoms to improve. We've said before that we need to monitor the blood glucose levels closely, especially in patients that we already know have diabetes. And physician approval is suggested for anyone with OA before starting the supplement, even though it's usually or commonly a patient prescribed for themselves type thing. They'll just start taking it on their own. ADRs, there really isn't any super serious ADRs, more of kind of the annoying ones like Dr. Allen has mentioned before: poor glycemic control for diabetic patients, increased intraocular pressure, GI, annoying GI problems, heartburn, nausea, diarrhea, constipation, drowsiness, hyperinsulinemia, skin reactions of different types, allergic reactions. Kari mentioned people who are allergic to shellfish, aggravation of existing asthma, and then possible swelling of the ankles and feet. For interactions, there's an increased risk of bleeding when taken with other drugs that also increase the risk of bleeding. These are specifically blood thinners, antiplatelet drugs, NSAIDs, and there is quite a bit of research saying if you take warfarin, you should not take glucosamine sulfate. It affects insulin and blood sugar levels, specifically in diabetic patients. Again, that's another thing that keeps coming up, so there's been a lot of research on that. Glucosamine also interferes with the processing of certain drugs and food happening through the liver's special cytochrome P450 enzyme system. We didn't really look into that too much because it's so specific, and interactions with acetaminophen have been reported in some people. Complementary drug therapy, there wasn't really any major other drugs. The only thing is that glucosamine sulfate by itself isn't really taken. It's always combined with chondroitin, so then it's called glucosamine chondroitin sulfate, which is just the same non-prescription dietary supplement as glucosamine sulfate, essentially available over the counter and basically at any drugstore. So special considerations, the author of our textbook, Saccone, he notes that the ideas behind glucosamine and its role in joint health are not completely backed by research. We're still kind of left with the question, like, is glucosamine sulfate actually beneficial in people with OA? The idea that glucosamine and chondroitin may stabilize cartilage turnover and suppress the production of cytokines that contribute to pain and destructive changes in OA joints are not conclusively backed by research trials. Some studies do say and have found that glucosamine chondroitin sulfate does decrease pain and improve OA patient function, but with all the studies that have been done, this hasn't been a conclusive result because there's been so many discrepancies in the study characteristics like design, sample size, patient characteristics, and other factors. But overall, current evidence points toward a conclusion that glucosamine chondroitin may not benefit any beneficial effects in all patients with OA. However, they may be beneficial in a subgroup of patients with OA, those ones that specifically have high rate of cartilage turnover. And it does appear from the research that has been done that these supplements may be worth a trial for patients living with OA since there are no serious adverse reactions. It's kind of a why not give it a try and see if it helps type thing. So for physical therapist implications, we treat a lot of osteoarthritis patients in all stages of the disease and its destructive characteristics. So if patients are thinking about getting a joint replaced or not, we might see them beforehand for just maintenance, pain control, daily functioning, and we will definitely see them after a joint replacement, whether it be their knee, hip, or wherever. A large percentage of our patients have diabetes, so if we're treating a lot of OA patients and a lot of diabetes patients, there's a good chance some of them are going to have both those things, so we need to be actively educating them on monitoring their blood glucose levels closely and regularly, and we may even need to help with that. There is an increased aging population when we enter the career field, and specifically like when our class is done with school, we'll be right kind of at the peak, I think, or near the peak of the baby boomer age. So patients suffering from OA, since they tend to be older, over age 50 at least, that's going to be a significant portion of our patients. And then we just always need to remember to follow our scope of practice We need to encourage patients to communicate with their physician. If a patient was to come to us asking, hey, I started this glucosamine sulfate pill, or should I take it every meal? Any kind of questions, we should just always refer back to their physician, because it's not in our scope of practice to talk about drugs and pharmacology with them. And then we just need to use the current evidence and research if they do ask us more specific questions or come back from their physician with more specific questions for us. So for a recap, what is it? Glucosamine sulfate is a disease-modifying osteoarthritic drug that serves as a precursor to the normal constituents of joint tissues. It naturally occurs in the body around joints, and it's usually combined with chondroitin sulfate and is available over the counter or non-prescription. Who would use it and why? People suffering from osteoarthritis, either just general osteoarthritis or in certain joints like knees. Some people with TMJ arthritis, and there's a few other conditions and diseases that can benefit from glucosamine. Some people who should not take it are those that are women who are pregnant or breastfeeding, children under the age of 18, those who have had or are having surgery within 2 weeks, and those suffering from other comorbidities like diabetes, hyperlipidemia, allergies to shellfish, and some others should take caution before starting it. People take this drug because it is a dual-class drug. It's an anti-inflammatory and an anti-rheumatic, so to aid in pain relief and to help stop the progression of OA. How would someone get it? People can get it over the counter or non-prescription at pretty much any drugstore, supermarket, Target, Walmart, Sam's Club. However, it's suggested that everyone does talk about it with their physician and pharmacist to see if it's safe for them. And people can use this drug in their home, as it's mostly always just taken orally in pill form. And then overviews of studies on it. Our textbook talked a lot about studies that have shown, since it is administered orally, glucosamine remains available in the circulatory system. So that helps aid in the anti-inflammatory and anti-rheumatic characteristics of it. Also, there is not a profound number of studies that have consistently found glucosamine actually does what we think it does. Even after the large number of studies that have been performed on glucosamine and its mechanism of action, we're still left kind of asking the question, does it actually help with OA? But studies that have found it to aid in decreasing pain and aiding in patient function have discrepancies in their characteristics. But because it is a drug with pretty minimal adverse reactions and it's a pretty safe drug, it's generally referred to as a worth-a-shot drug in patients with OA.
Thanks for watching.